Hello, my name is Anthony Kopp. I am a physiatrist at Mercy One in Des Moines, Iowa. We are talking today about the core muscles. What the heck is the core? So the core is a group of muscles that are made up muscles that help support your torso and your lumbar spine. It's included in your diaphragm, which works at the top. As that contracts, it helps pull air inside of our lungs. Our pelvic floor muscles, which contract from the bottom, and then the muscles that wrap around, including our lats, erector spinae, multifidus, all sorts of stuff. And then on the sides, transverse abdominis, and you have your rectus abdominis in the front. This is a brief overview. The big muscles that we're going to be focusing on today are our transverse abdominis muscles. These are on our sides here. You guys can push in and try and contract those as if you're going to blow out. So that's what it feels like to contract those muscles. These muscles are extremely important in the stability of our spine, and there is a certain way that they contract in order to improve that stability. So if you think of the muscle firing pattern like notes on a piano, if you push those notes in a certain order, that's going to play a certain song. If you hit those notes in a certain order, then that plays a melody that you're familiar with, that's soothing. It feels good. It gives us, kind of calm. If you hit those keys just kind of mashing on them, you don't really get any sort of melody out of that, and it's not music to our ears. It's kind of grating on the senses. So that's similar to what the muscle firing pattern is in our body. If those muscles aren't contracting in the right order, we're not playing the right song. One thing that has been identified with some research is this muscle, this transverse abdominis, is extremely important in low back pain patients. We see a lot of patients with that low back pain, that transverse abdominis muscle doesn't contract at all, or contracts much later than it should. This muscle on the outside here should be contracting first when we move any muscle from our elbow in. So when we're reaching over to pick up a pen, bend down, grab a paper clip, or lean forward to look in the mirror, bend down to pick something up off the ground, that muscle is supposed to contract. That's the first muscle, and then the other ones follow suit to help add some compression in that abdominal area. If you guys have seen a semi-truck, you're driving down the interstate, you see those black bladders behind the wheels, and they're bouncing along as the wheels hit the bumps. Those are the air ride system. So they add compression through there, and then that compression helps shock absorb the whole semi. So this is our shock absorber, our core is. And if you can imagine, if we cut out half of that bladder, that wouldn't be very effective for giving stability to that suspension or helping to control the shocks to the system. So being able to contract this transverse abdominis muscle is extremely important. And as I mentioned, oftentimes people with back pain, they just cannot figure out how to do that. We'll just briefly go over that today, but ultimately it often takes some physical therapists some good time to teach you how to contract these muscles as well as some others, like the multifidus, in order to add that stability to the spine. If that transverse abdominis doesn't contract first and doesn't start that air ride system, then there's other muscles that try and kick in to help. A lot of times we see this with people that get a psoas spasm. A psoas is the muscle that lifts our leg up. So you'll see people who go to stand up. Normally the psoas should be lengthening in that as they're standing up. But people start to stand up, the transverse abdominis doesn't contract, and they get a spasm. And it hurts. And then you'll see them they go to stand up, and then it's almost like they're a plane taking off, or they're like, then they can slowly start to walk, and then finally they're able to walk upright as that stops spasming. So we really want to reinforce the importance of how those muscles fire. So putting your hands on your belly, blowing out, just feeling that contraction on the side of your belly, that's that transverse abdominis. If you're having back pain, it's a good exercise for you to do, just to, as you're sitting around, even in a chair, trying to keep that sucker engaged, and that will be helpful to let some of the other muscles relax, because that big dog is keeping that compression, and that's offloading them. Physical therapy, as I mentioned, is vitally important, teaching patients how to activate this, and then ultimately, as we're getting the activation effectively going, and that activation is correct, then we can work on building the strength. So once you're able to play that song initially, then you can start to play that a little bit louder and play that with a little more gusto. So hopefully, through your PT and you doing your exercises, you'll get to be playing some better music in your life. But it will take practice. Hopefully you're up for it. Thank you and have a good day.